questions as they come up. Thank you. Angela?
There we
Nope,
go.
looks like you're on mute.
Am I quite okay now? You can hear me?
Yes, yes.
Okay, great. So I'm Angela Davis. For those of you that didn't hear me in the first session, I'm a principal solutions architect with Gainwell. And this morning, we have a lot of information we're covering today, but we're going to take a little break from claim and switch over to case management. So Maria, if you want to go ahead. So before we get into the demo, there are a couple functionality changes that we want to call your attention to. Changes that were made in Administrator and so have subsequently moved into View 360. A few of those things that you will see today is multiple protocols per case program. That's a new feature. We have a maximum program number with threshold alerts and then a wait list for waiver programs. So those are new features that you'll see that were developed for Administrator. Let's see, we also are going to show you that new, the UI, the View 360 is intended to take all of the information and show it in a single point. So we're going to show you that today. There's enhanced features for state case managers, and then again, that single point view. There. And we can move ahead, Maria. So some of the efficiencies that you're going to see are advanced search and filter criteria. So View 360 takes a multi-search approach, and you're going to see that in case this morning. You'll have consolidated complete case processes. So instead of different menu bars, you'll see it all in one place, easier tabs across the top. You have the recent activity records one-click return that you see in many of the view screens, very efficient. We have the supervisor overview for efficient assignment, monitoring, and management basically of the entire case team. Again, we have the waitlist programs and thresholds that will alert when you're approaching a threshold or a limit. A nice feature to have. And then multiple protocol consolidation. All right, I think we can move ahead. There were no questions submitted for case management. So what we're asking today is that if you have any questions, please, like in the previous session, that seemed to work really well. Use any of the ways that you can raise your hand, you can just interject, or you can type in the chat, and Rochelle will be monitoring that so we can get your questions answered. All righty. At this point, I am going to grab the screen. And then hopefully you can see my screen here as I go into the demo environment, and tells you again, this is all fictitious data in here. And I'll remind you again, as in claims, we don't have anything custom in here for Maine. It's just a generic demo environment. So if you have any questions there, please feel free to ask that, and we'll try to cover. So we'll move into the case tile in the center of your bar at the top there, your horizontal bar. And basically we're presented with the search. And many times when you move into a tile, it'll open the search bar so you can get to what you need. Any of these data pieces you can put in here, basically create that query that we talked about before. I'm going to go ahead and filter on my own cases this morning, submit the query, and then we get results back here at the bottom of the search bar. So we're going to go ahead and grab the case. We'll just grab one of these today. So as we open the case ID, you can see that we land at the care plan page. You can see here who the care managers, excuse me, I should start at the top where you see the member, the program, and then the case ID. There are also alerts and notifications, as you see on all of the pages here, and an indication of active enrollment. So we open that, you can see that there is an active case program for health management. Close that. Then we move down into the care plan, and you can see what's going on here with the case. There were no protocols found for this, but we can see that the primary program is health management. It's not a critical program. The status is in process, so this hasn't been reviewed yet. Moving along the horizontal, well, let's take a look at case events. There are no events due for this case, but were there, they would be listed here. Again, with attributes. Case notes, documents and letters would be here. It's gonna hang up just for a second there. And then you can see assessments as we let this clear. Okay, we're spinning here for a minute. Seems like we have an exception out to CENTCOM this morning in the dev environment. That doesn't happen in production, but in dev, our connections are a little tenuous sometimes. So we can also see from the care plan if there were any calls, they would be listed here. Here are your contacts, any providers associated with the care plan, authorizations, and then a history of what's happened. I'm going to go back here from the work queue. All right, so what you can also see here is that when a case has been routed to another case manager, you have an alert here that tells you that the case is waiting response. So this one has been routed, excuse me, not routed. It's been sent to Cindy for information, but it hasn't routed. It actually stays in your queue. So we'll take a look here. You can see for this member that we have two programs, imminent risk case management with a protocol attached, and then complex case management with a behavioral health protocol attached. These can be edited. Programs can be added from here. Protocols added. And then again, if you want to route the case or edit the case, you have those buttons here. I'm having a little problem here with latency, so I'm hoping. Pardon me?
Was it just me or did we lose Angela for a minute? Okay,
Rochelle,
sorry.
you're a little breaking up, Rochelle. But I think with Teams right now, there's a latency reported in Teams, so apologize.
Yeah, it seems I'm having some latency issues too. So if you just bear with me, we can walk through this and raise your hand or let me know if things are not looking right for you. Okay, so moving off the search bar, we're going to move into the work queue where you can see events here, assigned cases, assigned case referrals, and then routed cases. So this is for my work case view. If we want to open a case to see events, grab the pop out here, move into case events, and see what's awaiting here. So here we have an assessment that needs to be done. It's in process, but it hasn't been completed. So you can go here and add events, or you can edit the assessment or run an assessment. If we look over here, there are none that have been completed. There's just an event waiting. We do have a case note on this in this care plan. So here's where I would work my events for all of my cases. Here are the assigned cases. Again, this will show us routing information, whether there's a response required from another case manager, status of those, protocols that are waiting, and again, pop out to member information here. Here's some referrals that have been assigned. You can see here the reason for the assignment. We'll go ahead and open one here. So you can see that this member has been referred by family for a case management program. The intake assessment has not been completed at this time, and if there were any attributes, they would be listed here as well. So you could go ahead and edit that record if you were going to take a look at what was in there. You needed to add a note. You could do that here. If you wanted to work the referral, let's grab this one here. You have the option to create a case, decline the candidate, or resolve the candidate here, all at the bottom of the page. If you decline the candidate, you can see that you have, it'll default to date, system date, but you can also indicate the declination date and the reason for the decline here. And those are all configured in Administrator, but they can show here. And then you would go ahead and add notes if you needed to. Okay, and then in routed cases, excuse me. You can see that this case manager is Cindy. However, she's routed this case to me to complete these events down here. You can see what's going on. You have your edit, you have your ads. You have any events that need to be completed here. Follow-up calls that's incomplete, school counselor letter that needs to be sent. All of those can hyperlink from here, so you can do what you need to do from this management screen. Go ahead. And that's all in your work queue here. Oh, excuse me, here. If you need to just look at referrals or you need to create a referral, you can travel here to the referral tab. Here's where you can create your referral. If you needed to look up a member, you have your spyglass here. You have dates you can filter by. You can look again by case manager, by status, or by reason. If you were going to add a referral, you can pop out here and grab your user. I'm going to grab Diane Jones here. Here's my referral date. As a system date, you can add a note. Here's the history. There are no other existing candidate records. That. And you can see that the referral was successfully added. And here's a pop out to that referral. Navigating to the supervisor tab. This is your amalgamated view of all the cases. So you can select by department. This one selects all. So here's some of the ones we have configured in the demo environment, but those would be unique to Maine. Here are the case managers. So if we come down to my cases, here are my current cases that I'm working. Here are my candidates. These are unassigned, so it can be assigned by a supervisor at this time. And then here are my current assigned cases that can be reassigned. So let's say I'm not getting this done and we need to reassign this case. We can go ahead and do that. We'll assign it to Cindy. Excuse me, I need to first look. We can just assign it there and save. That will move into her queue at that time, and you can see here that it was reassigned successfully. We can also look at events. There's a send message feature. It isn't hooked up right now in the demo environment because of bandwidth and some other technical issues, but you could select and send a message out to the case manager from the supervisor queue regarding information on this, or maybe something you need to add. And then moving to wait list, you can select a program and see the information here regarding wait lists. So this program you can see has an active wait list. There are a maximum of 100 cases. The threshold percent is 90. So you'll get a message when it's 90%. So when you're 90% full, you'll get a message back that lets you know that you're nearing the threshold. Right now, there are 2 members assigned, so there are 98 slots remaining for the complex case management program. If there was an active wait list, so we had maxed out the number, here's where your wait list members would show. Right. Are there any specific questions? Do we have any case managers on the phone this morning? Nope. I'm not hearing anything. All right, so I think at this point, given this latency issue I'm having, we can go ahead and take questions. If you have questions afterwards, please feel free to submit those. If there's any questions or any clarifications we can make for you at this time. But I think that will conclude our demo. Maria, if you want to grab the oh, it looks like we may have a question. Do we have a question? No.
I don't see any in chat.
Okay.
So final call for questions on case management? Or anything that we might need to recover in the claims? Any questions from that session?
Do we have any of the case managers on this morning? Okay. Since we did set up that extra session for prior authorization coming up on Thursday, we may want to let the case managers, I know that there is an opportunity to create authorizations attached to a case. They may want to join that session as well, just a little FYI there. But at this point, I think we can toss back to Cindy, and she's going to head into configuration for us this morning.
Yeah, is Rick on the call? Rick Hayward?
No, he
And it was-
dropped. He
Okay,
dropped
this
earlier.
was scheduled to start at 10:45, so I just want to make sure that everybody's on that would need to be on for config, or again, it is recorded. So does anybody think that any anybody significant is missing at this point, or can we move forward?
Rochelle, I
Hey,
don't
Rochelle.
Mhm.
see anyone from the config team.
Yeah. So for that far ahead of schedule, I think we've got a concern because I would definitely want the config team members to attend. What time are we scheduled? Were we scheduled to start at 10:45?
Yes.
Is that right?
Yes.
About 10 minutes from now.
Yeah,
why
can
don't
we just take a break?
Yeah, okay. That sounds good, and come back around 10:45 then.
All right.
Were the config team members, did they receive an invite? I don't see them on the list of participants.
This is Trisha. I'm here from
Oh, you
config.
are here.
I don't
Okay.
know.
Did you
if
get an
Elaine and
invite,
Heather
Tricia?
are. Yeah,
I'm
I
here.
accepted the invite for today's
Okay.
meeting.
Did you
Okay.
just come on, Trisha? Because I didn't see you earlier.
No,
Is
I've
that
been on
right?
since the start,
Oh,
all
okay.
morning.
I must not
Me
have gone
too.
down to the bottom. I see you now.
Sounds like Heather's on too.
I am.
Is she hiding?
No,
Where
I'm
are
here.
you guys?
I don't know
Oh,
if
it says
Elaine is or not.
see more. I see more.
See more, Carlene.
It looks like
That's-
Elaine might be on too.
Yeah,
Okay,
she is.
perfect.
Okay,
Awesome. Well, we can proceed then. If you guys want to go ahead.
works for me.
Great, great. Cindy, are you ready?
I am.
Okay, thank you.
Sure. All right, so we can go on to the next slide. And today we're going to look at some of the configuration changes since 4.8. We're going to look at both view and administrator today in this session because of the database changes and some of the new items you'll see. So major changes in the area, again, with the administrator UI, the compliance updates from IE. Some of the updates to databases, some of the new edits and the configuration updates and clean finance codes. However, today View 360 really is your major operational game changer. It gives this data a single point of access to see and validate all the information in one location. The configuration data output can now, again, all be seen in View 360, eliminating the need to access administrator for most of your daily views and searches. On the next slide, we have some information here as well. That configuration will still be done by Gainwell staff and administrator. However, View 360 will be where everyone can access the configuration information after it's completed. It does provide that 508 compliance and the same look and feel as our other areas that we've been demonstrating. It's an operational focused UI with search and find capabilities. Some features we're going to cover today are the configuration views in View 360, searching reference data, contract and benefit lookups, fee schedules and downloads, rule setting, and in administrator, then we'll take a look at the copay configuration, some limits around configuration options, NCCI configuration, and benefit reconfiguration to assist with some scoring issues. On the next slide, we can talk about our efficiencies for the configuration regarding the accessing of the data in View 360, like the rules, accessing contracts and benefit information, looking at the reference data quickly, being able to filter and search, seeing the downloaded fee schedules. Anyway, all the information on config is in one location in the UI for research efficiency. And then benefit limit scoring by implementing best practices is an efficiency of our new system. The elimination of some of the main custom code where applicable to increase adjudication times as well. Changes since 4.8 include spin down configuration, availability and benefits, claims, member and rules. We have new edits around NDCJ code and ordering referring providers, multiple surgery logic config and global days and NCCI. So on the next slide, we'll review some of your questions for today. Discussions around benefit limits, including fiscal year, some of the scoring issues and best practices, code searching and reference, and how to do that. We'll take a look at the NCCI tables and the new ones in the new system. In general, there was a question around changes in config, and there are quite a few that I'm going to show you today. So hopefully you'll get a good feel for that. There was a question around orthodontia benefit creation. I have an example to show. And then as well as the copay, COC and share of cost, new tables that are in the system based on the discussions we had in the claim session. And I am going to actually, from here, I'm going to go ahead and share my screen again. Okay, back at View 360. Again, all of the information for config is in one location in the UI here for research and efficiency. Again, as we previously mentioned, all the configuration done by the Gainwell staff is still going to be done in Administrator, and then can be seen as those changes are made in that environment in real time. So as the changes are made there, you're going to be able to see them in View 360. They'll still go through the normal progression. It's the syncing and processing, but as it's made in Administrator, it is viewable in View 360. We're going to start out our tour today in our configuration view tile. We gave a quick, very quick review of this in our overview. So we're going to take it a little slower this time and call out some of the features and functionality here that's available to you. And then again, at the end of this, we'll jump into Administrator. So starting out in our configuration view is the, we'll land on our program tab so you can see all of the programs that are configured within the system. These carrots do show the benefit plans that are associated to the particular program, as well as the hyperlink and pop out to those benefit plans. But we're going to just jump right over into benefits so we can get into all of the details here. So within the benefits, again, you're going to see the benefit information from recently accessed below, which is a great feature. So I can come back into something I might have just been working on. Otherwise, I do have a basic and advanced search capability at the benefit level here. So I can search for benefits by program. So if we're going to just choose a particular program, I can search for different plans, which is a multi-select choice here. But I can also search for service codes, revenue codes, and even the coverage codes, and pull back a list of benefits that pertain to my filter and my search. From here, if we wanted to go into our fee-for-service benefit, I'm just going to go ahead and open this particular one up so we can take a look at the details. I'm at my header level here with the benefit plan information, the ID, the coverage type, and the program name that it's related to. I can see here over in the window, this little light bulb's telling me that this is an active benefit. This is the header information pulling from Administrator. So if there's any active copays at the header level, active coinsurance, or active limit types, again, at the header information. Moving over to the next tab is the benefit detail information, and a great feature that I'm going to show you here is our multi-select. So there was a question around orthodontia, and so what I want to show you is that I can select both of those benefits, one for over 21 and one for under 21, and search. And what this does is provides me the look at both of those benefits. I say side by side, but it's really on top and bottom here. But it allows me to look at them and do the comparisons. So at the very top here, and it's kind of something that I'll try to point out as I go along so you can follow along, but it's the benefit information, and here's the under 21 without PA. No PA is required as expected. And then we have our benefit effective and term dates here at the very top. And moving down as well in the center of the screen where we have the dental services for over 21. Again, no PA is required, and here's my effective, and then if there was a term date. Moving back to the under 21, I have the multiple tabs as we go across the center of the screen here, landing first on the service limits. So for both here and for the over 21 below, I have a 1 per 150 rolling days for both of our benefits.
Hey Cindy,
Yes.
there's a question. It says, I believe the orthodontia question was related to whether we still have the ability to actually create these rack / add them to a member and view.
So we'd have to look at that during implementation because I'm not sure on the policy requirements, but we do have the ability to create coverage on the member's record. And so if the member falls into a specific coverage, we can restrict it to certain services. And if they lose their coverage and you still want to continue paying and pricing for those orthodontia services, we could add a specific coverage that extends that. So it all depends on the eligibility feed information and how you're getting it and based on how we can configure. So for instance, right here, the next tab over I was going to hit is restrictions. So depending on the coverage code information, and I'm showing here, whatever might fall for your rack code, either 49 or 50, if a member is assigned to a specific coverage that allows them to have those services that are in this benefit, then this is where we could restrict it based on age, gender modifiers, coverage, provider type, and specialty. And we also can have the ability to exclude certain things like places of service. Any other questions on that part from the rack perspective?
It sounds interesting, Cindy, thanks. Those are the only two racks we actually, they're not generated by another agency. We actually have to assign them to a member in
Okay,
QNext. So that's, I
okay,
think that's where that question was coming from, but that's good to know that this functionality might be able to address that within benefits.
yes, yes. And you can add the coverage as applicable to the member's record.
Okay.
Okay. But still, again, a great feature to do the comparison on benefits. We can look at the service group information. I'm going to select both under each one of these benefits, which are showing me. And again, this is just demonstration. So I didn't have an orthodontia one set up. So I just used dental. But we have the service groups that are tied to the particular benefit. Procedures, procedure groups, cover drugs. And here's the required document, where you'd see the information around the document and the type of document and whether or not the review was required. So again, a great feature on the benefit side to be able to take a look at this information kind of side by side. There was a question about benefit scoring, and we'll talk a little bit about that at the end of the session. But this is one example of how configuring by coverage restrictions can assist in the elimination of some scoring issues. So that's one of the items we'll take a look at during the implementation. At the benefit level itself, we have anything at the header level for excluded services. So if there are any excluded services on this particular benefit, any restriction groups that were applied, or any limits and accumulators at the header level. I'm going to move into pricing now. We're going to take a look at our contracts. Again, the ability to search and filter on the contracts here regarding contract name. We even have the ability to search for service code and descriptions, program affiliations and modifiers. So another great feature for whittling down to what you were looking for. Here, we're going to just open up one of the contracts that I recently looked at. And we also saw this in the claim session, but we'll dive into a little bit more here. So we're at the header level here for the particular contract. We can see here whether or not there's any fee-for-service withholds, any carve-out services. We can see the programs that this contract is affiliated with. And then scrolling down to the bottom, you can see all of the terms. And if we want to filter on any of the terms, again, for another look at the terms and pull it back information, we can do that here.
Hey Cindy, a question. This will allow us to search a code and it will bring up all contracts the code is in.
Yes, ma'am. Hit filter. It's going to bring me back the list of the contract terms that have this particular code in it.
Does it actually tell you the contract though, or just the terms?
This is telling me the term at this level because I'm in the filter term section. Going back here, I can search it at the header level. This will tell me the contract. Of course, it's probably quite a bit. There's quite a bit in demo.
Yeah.
But yes,
Okay,
I
so
can do it here.
that's new then, because that's not something we can do now. We have to individually go to each contract and search codes. We don't have a function to search a code and find out all the contracts it's in within the system. So this is great.
See if I can find another code for you. No, it's going to pull back too many. So, but anyway, yes,
Yeah,
that's available here.
yeah, that's an excellent option.
Great to hear. Okay, again, at the header level, though, we have the same type of thing, any excluded services, any restriction groups, any affiliations, and then if processing capitation, the capitation information hangs at the header level. Okay, let's go back and take a look at our information. So we're just going to open up physician administered drugs term here, just to kind of show you what's in here. So again, we have our term and our contract information. Any restrictions at the term level for minimum age, maximum age, modifiers, provider type, and specialty. If the term requires a if the benefit does, indicator here. If it's penned for manual review, capitated, EPSDT. In the center of the screen, I can see that this particular term is assigned to a custom fee schedule. By popping out to the custom fee schedule directly from here, I can see the fee schedule information. I can sort by provider type, specialty, place of service. I can export this to Excel. This is a demo fee schedule, so I do have information in here around revenue codes. If there's long-term care codes or NDC information in this fee schedule, we could access it through here as well. At the bottom of this screen, again, we have our multiple tabs. So if there were any restrictions on this term, valid places of service, bill types, diagnosis code restrictions, service groups, services, and our service groups as we're utilizing going forward. In this case, this is our COVID-19 service group with all the services that are applicable with their effective and term dates. Any procedures, procedure groups, covered drugs, or again, any required documentation. So all seen from our configuration view. We're going to move over to rules, and we're going to spend just a little bit of time here because there are quite a few new rules, but also a great feature for you looking at the rules. You don't have to go in by program first. We're actually going to select the category first. So I'm going to choose the benefit category. Again, a great feature just to search and key in the benefit rule ID that I'm looking for, in this case 205. I'm going to filter. So this view is going to look completely different than what you're used to seeing at Administrator. So let me walk you through it. We have multiple tabs here. First is our system rules. This is the default action and the default information that comes out of the box with our system. So you can see what that would look like. However, right next to it is program rules. Now our program rules, I'll just shrink this one down. As you know, we can set edits differently for every program in the system. In this case, we're just going to look at the fee-for-service program. Here at this particular level, I can see 205, benefit requires the action and the default action that we just saw under system rules. That's what comes out of the box. But right below it, I can see the activities that make up this particular edit and what their current action is. Again, these are configured in Administrator, but I can see them here in view. So for all sources, for EDI and for online, we have our pinned status for this particular edit. If encounters are applicable, we're going to set this edit to warn. And then for our paper, for our non-EDI override, we have the edit again set to pinned. We can see properties from here, if there's any rule reasons or types that need to be applied, and any rules that can override this rule. And these rules are coming over as well from administrator. Any org policy rules that are configured can be also seen in View 360. So I'm going to reset. And I do want to kind of talk you through a little bit about some of the new edits that are in the system. And I'm just going to show you a select view from a search feature. You'll see why, because there's just quite a bit. So most of our edits that are brand new start with the 11, and they're a 4-digit number. So within authorization, we have a new edit for criteria match for predeterminations. So if predeterminations become something that the state would like to use in the future, we have the edit here for criteria matching. That's under auth category. Under our benefit category, we're going to take a look at this one where the benefit requires individual income detail editing, as well as the benefit requires family income details. Of course, behind each one of these new edits I'm showing you today is logic behind there that would need to be configured to allow those edits to actually post. We're going to go on to claim. Quite a few in claim. So we have purchase or rental price has been exceeded edit. Some of these do not apply for Maine, but the request of the host plan for review. We have an accident LOI, no response, pursue and pay. We have a coverage expired. We have benefit bypasses spend down at 1104. 1105 secondary enrollment and spend down exists. 1106 line from date exceeds the spend down period. And then we have ITS claims, which you guys are not using. 1108 claim is part of a patient bundle. 1109 there's an error in the payment bundling. This one is claim contains PM42, multiple inclusive groupings. Here's our connect adjustments when we were looking at our review. So any adjustments coming through Q-Connect for EDI, any correct adjustments or void claims requires review or pending for review, or if they're pending for an original claim. (1116) units usage inconsistent on referral. 1118 use pay to contract when rendering provider is the member's PCP. Enable the duplicate check by member ID and health plan ID. Duplicate member provider bill type admit discharge date editing. Enable the order refer. Claim requires ordering referring. An order referring NPI type is invalid. And provider not eligible to order refer. So those are some of our new edits around order refer. We have some overlap.
They sound very much like our custom edits.
They are no longer custom. That is correct.
Good.
Then we have quite a few overlapping service editing regarding outpatient, long-term care, and hospice. Scroll down. Here's our PTP, so our procedure to procedure. 1132 code to code edit bypassed. 1133 there's a major code in history. 1134 component code in history. And then we have our share of cost edit that's ineligible for share of cost calculation, that there's multiple types on a claim. We have our connect adjustment reviews as well. 1138 with multiple procedures on a billed claim. 1140 multiple procedure payment reductions. 1141 eligible for multiple procedure reduction, history claim needs adjustment. There's a pre-op and post-op procedures billed in history. 1144 claim data services after the member's date of death. And then we have our two NCCIs, actually three. 1160 NCCI MUE criteria has been bypassed. 1161 MUE edits exceeded on a claim line. And 1170, there's an add-on code requires a primary code. So that's for claim. Told you there was quite a few. Well, under the contract, we've got two with multiple procedures, claims submitted without a modifier 51, and a multiple procedures billed applied the tier modifier discounts. Again, configuration would have to be done to enable these. And then we have our general. Spacing it is not in general. We're going to go to member. The new edit in members 1145 data death missing for deceased member. And then provider is your ordering referring provider needs an active license, or your ordering referring provider status is not active. Now there's a test. So can someone tell me the new? No, just kidding. All right. Any questions on rules? I know there were quite a few new ones, and again, those will all be covered during the implementation.
Cindy, are there updates to like older rules? So I guess I'd have to look at the PDRs, right? So like Duke checking 532.
Correct. If there were any changes to those edits, they would be in the informational assessment pieces, but I don't know all the level of detail to that
Okay.
uniqueness at
Okay.
this point. It looks like Diana has her hand up.
Yes, by Connect, are you referring claims received via EDI?
Yes, ma'am.
Okay, thank you.
Mm-hmm. Is there anything else before I move on to the fee schedules?
So quite a few of those edits we've already created custom edits for those.
Correct.
So what happens there? Do we make sure that the new edits do everything we have put into our custom edits, or how does that work?
So yeah, so there'll have to be a remediation and assessment done, right, during the implementation, and you'll test out the features and functionality. Just the edits that are there are referencing new tables in the database, right, and new information that can be applied in Administrator. So therefore, it should eliminate those custom codes that you have and custom processes, because those tables now exist in the system, so they don't have to be called outside the system. So those new edits that are there, I know you do have a lot that are already doing that functionality, but it will do it within the core system at this time instead of your custom.
Okay, we'll just have to make sure it behaves the same way, or if there's a difference,
Exactly.
it's if there's a difference, it's a difference that we agree with.
And maybe, and there may be something that's specific to main policy that takes it one more step, right? But if you can get the most of it done within core and then change your custom to just be one little process, that's a lot easier than a whole list of custom, right?
Yeah, and
Yeah.
then our initial assessment and all those were documented, the specific main customization, so that those can be moved over. And if the code exists in the product, and to use it there. If it doesn't exist, then to continue the custom code, but you'll still maintain, as we've been saying, all the functionality that you have today in that customization.
Okay, I'm just a little leery because I know in the past some of the edits didn't perform, the core edits didn't process the way Maine wanted them to process. So they left some pieces out that we felt were important. So I just want to make sure that before we move over to the new core edits, that they do perform everything, that all the checks and balances that we currently have in our custom logic.
Yeah, and I don't disagree with you, Diana, from that perspective. Again, I think if there even are some fields you can utilize instead of the entire custom, move what you can into core and then create or addendum onto that, right? So that you're not creating a whole custom process that you have today when you actually have some fields that house the data. So it just is a remediation of that code and where to find the information to get to your end.
Okay, so if we had to modify it, would we have to pay for the modifications again?
That's not for me to answer, so
Okay.
we'll take that
All
back,
right.
but I
Yeah.
believe the remediation stuff, yeah.
I mean,
I'll address that one real quick, Cindy.
Thank you.
Right, so the custom code that you currently have in Maine and the functions that live in the system as it is today, right? Certainly, the goal is to remediate all that as much as possible to the core product. If we cannot, and the maintenance of, and we have to maintain some of the pieces of Maine's custom functionality, that to get the system to do what it does today is included in the upgrade. So you're not going to pay for it again, right? So we're not going to say, oh, we're giving you a new system and now your custom code, we're going to charge you again to do all that. When we deliver the system, you will not have any reduction in functionality of what is delivered today.
okay, wonderful,
Okay.
thank you.
Yes, ma'am.
Thanks, Kevin. All right, are we good to move on? Rochelle, is there anything else in this chat before we go?
No, nothing in chat.
All right, gonna go over to fee schedules. We did already look at a fee schedule when we linked over from the contract itself, and you'll see my recently accessed ones below. But the great feature here too is that I can search and filter on any of the different types of fee schedules. I can search them up by a contract. I can look for all fee schedules with a certain CPT code in it, certain revenue code, effective dates, even NDC numbers. So we have the ability to pull back a list of those fee schedules right here in View 360. Again, we can access those fee schedules. I'll just open up this one in specific. So you can see all of the detailed information again and export that information to Excel.
So based on what you just said, does that mean that we can now assign fees by NDC if we wanted to do that?
You have the ability to create and price off NDC as a fee schedule. Yes.
Okay, thank you.
I've not heard that talk before, Diana. Is that something?
That was something we were looking into quite a while ago, and it was determined we couldn't do it. Yeah.
Yeah, I remember that now that you say it.
Yeah.
Yep. In Administrator, in 5.x, when you're attaching your payment type in Administrator, you have the option in the drop down or in the bulleted section there for NDC.
Thank you.
You're welcome. All right, reference code, really great feature, at least for me when I'm trying to look up information, trying to key claims for demos and stuff. I could go out here and search and find the data that I'm looking for. Pulling from reference data this is a search feature. I can search by our different CPT groups. All of the code sets are applicable or that are applicable in this section from coding. I have access to see the code ID, again, the information that comes along with it, any effective and term date details. I can search for the code or search for the by description as well in here. Same thing with revenue codes. So I'm searching for revenue code groupings. I can pull back the complete list. Surgical procedure codes, same way. I can search for specific code set by description. NDC, I have my NDC groups. I can do drop-down lists. And get the information. For dental services, these are I'm pulling from the CDT groups. So if Maine moves over to CDT groups, this is where you'd access your dental services. Otherwise, I believe today you're accessing them through CPTs. Diagnosis codes, again, you can search and we can just key in part of a code and it will pull back the data and the information regarding it, or you could search for partial descriptions and we'll pull back the words as well. Modifiers, we have our full modifier list here with effective and term dates. And even edits and adjustments. So if I was searching for a specific rule edit, it would provide me with the rule itself and the carks and marks that are associated in the system that were configured. Or vice versa, if I wanted to just look for a specific adjustment reason code, I could do a search and it will pull back all of the edits in the system that are assigned to that particular reason code. So a great feature here. Any questions on reference codes before I move over to COB carriers?
Yeah, there's
Yes.
one. Yeah.
Okay.
Would this be where the service groups would be found that are currently in HealthPass?
No, the service groups, this is the reference data used to build the service groups. Service groups, you'd see them at the benefit level. So once they're used in either benefits, contracts, or authorization, you'd see those service groups assigned to those areas.
Is that on that second tab that's showing in the gray? Benefits.
It would be in benefits. Yeah, and I did show that at the benefit level. Mhm.
Okay, thank you.
Would a contract term restriction group, would that be under contracts?
It's under pricing. But yes, it would be under the header level. Restriction groups, I think I can pop that up real quick. Restrictions groups would be here, if applicable.
These are tables that we use in some of our coding.
Okay.
That-
mean, they're
yeah,
still
that should be
pulling-
Fine.
It's
That
still
should be
pulling
fine.
from administrator, right? This is just where you'd see it in view, the table structure for this. In some cases have changed a little bit, but in these areas around restriction groups, I don't believe there's been any changes at all in administrator.
Okay, thank you.
Diana, are you concerned because they might not be attached to a contract?
Sometimes a lot of this reference tab is in the claims finance groups or
Oh,
whatever it is in
That's
on
correct.
different things. So and we also have some of the service groups there, and I was just wondering, and a lot of those are contract term restriction groups. So I was just wondering if those were going to be there, or if we could have to go into the contract area like we do in the current health pass.
So what you're going to see here in just a moment, and I will walk through the changes in config, is the configuration is still done in administrator. So all of those options and claim finance codes and at the sponsor and policy administrator, all of those are still configured in administrator itself. View 360 is really for that end operational user who's going in to see why and how something works. So all of the options for config, you're not going to see through View 360. You're just going to see what has been configured and assigned to a benefit, what has been configured and assigned to a contract. So it's more operational based versus config based.
So what we have been seeing currently is you get the name of the group, you click on it, and it'll show you all the codes that are related to that group. Are we going to be able to get those through contracts in here?
Yeah, so yes. So I just don't have one set up, but here's a restriction group, for example, for benefits.
Okay.
So I can see the restriction groups that have been created. And I can link out to those restriction groups and the information that might be within it. Here's your services.
Okay,
Perfect.
thank you.
Okay, does that help?
Yes, thank you.
Okay.
And Heather has a question. Is this just a limited number of types of reference data?
Help me with the limited types.
So like in the reference codes, there's like, how about modifier, CPT, code combo? I mean, are you going to be able to see all the different types of reference tables that we have now in View 360? Or is it
So-
just what's shown here now?
It's just what's shown here now. The
Okay.
modifier CPT code restriction configuration is still, however, in administrator, but you're
Okay.
in view, you don't have that relationship at this point. Doesn't mean it
Okay.
won't ever happen. It's just we don't have it right now.
Okay, thank you.
You're welcome. Okay. Since we already looked at restriction groups, because Diana likes to work ahead, we're going to go into COB carriers. And just for the ability to show you that we do have the information stored here for the ability to see directly regarding your any of the COB carriers configured in the system. So address and information. All right, so from here, I think we're going to jump into administrator unless there's any more questions in view. Might take me just a minute because I know it probably timed out. Get to my notes. All right, we're going to first start out with one of the questions that was around benefit options for limits. That is a comment made that rolling was a little bit confusing, and possibly adding the fiscal year, and then a question around how does the system know about the calendar month and how to determine that. So we're going to start out first in our benefits. And administrator, I know you guys are pretty familiar with this, but again, I'm not in Internet Explorer, so we're going to go ahead and do the drop down menus here. As you can see right now, what I was just showing you in view, I went right to the benefit that I needed. I didn't have to go through all of these drop down boxes to get to where I wanted. So bonus for that.
And
But to show you
Elaine,
the
and Elaine, Cindy's going to correct something I told you wrong, just so you know.
I thought we weren't going to bring this up.
I had to fess up.
Okay.
I said it and then she went, oh no. All right, so I'm going to hit edit. Again, this, if I need to go back and do something, I'm assuming that most of you are pretty familiar in here. So we're looking at the general tab. For the question around the limits, we're going to go into our visits. We have the information here in the system calendar month question. Calendar month, the system does know the days in the months, and it is looking at the date of service on the claim to determine how many days are in that month to apply the limit to. So if you say one a month, it'll know if December has 31 days, so it'll assess that if one has happened in the 31 days. We do have information regarding, and here it is, Carlene, plan year. Plan year is, could be, I'm going to say, your fiscal year. So at the sponsor level, when you configure your sponsor, which holds the Medicaid program information and config, you can set up a plan year. That plan year you can configure, and I believe Maine has already with the fiscal year information. That being said, if you were to select a visit limit by plan year, it would use the sponsor's year date that has been configured in the sponsor module.
Awesome. Thanks.
Okay, also here, while we're in benefits, is the visit accumulators. We can accumulate by service code. These accumulators are all configurable. This is an example, purely an example, but you can accumulate by service code. In this case, it's a per day limit. We can add multiple benefits in here so that you're accumulating by service code across multiple benefits. So that accumulator can be added to the benefit itself. Accumulate by service code is now a checkbox. We also have the authorization to do a prior auth override, or configurable option here.
Cindy, just a quick question. The long-term care COB, will the letters be housed in this configuration portion?
The letters. I'm not familiar with that.
Could you expand, Richard, on the question?
Sure. When we're looking at claims that have, or members who have a long-term care policy,
Mhm.
and we typically will receive a letter once they have met the limit for that long-term care policy. And then that is something that we will house as a reference to, yes, their long-term care maximum has been met. So then, we kick in as like the primary.
I
So
see.
with those long-term care letters, would they be housed as part of the configuration?
They're actually housed, they're gonna be indicated with the member's ID information, so you'll be able to access all of the documents and letters for a particular member on the member screen in View 360. So you'll be able to access those letters right through View 360. If you need to change any eligibility or spend down information, we're gonna or any share of cost information, we'll take a look at that in just a moment once they've met their limit. So that gets applied to their member record, and then we can bypass anything through the benefit itself. But it's not in this window here for that piece.
Great, thank you.
Mhm. So while we're here in benefit, let's go ahead and take a look at the general, going up to the general tab. We do have share of cost types. This is something that's new where we can add the share of cost to type to a specific benefit. And we have the ability to bypass spend down. We also
Diana.
on the limits.
I do
Go
want
ahead.
Diana and whoever deals with share of cost. I kind of really want, I'm gonna grab some screenshots here because I really want to try and figure out how we use as much of the system to do this work as possible. This, I think, is one of our biggest opportunities for change and use of the system and how it functions. It may not be perfect and we might have to do a little more, but we're very far away from using any part of the system today for share of cost and copay for that matter.
Yeah, and we're gonna actually, in just a minute, we're gonna dive into those tables too, Carly.
Great.
All right, before moving out of benefits though, let's hit limits. So within the limits information, we have the accumulators where we can accumulate for annual out of pocket if there's senior gold or any items like that that we can configure here for you for choices for your actual limits in the system for dollars. So just wanted to show you that. I didn't know if you have the accumulator ability to configure those across programs. I mean, across benefits. Okay. I'm going to go back to the home screen then. We're going to start looking at some of those tables that we're discussing around copay, share of cost, and the information that you have today. So starting in 5.x, these enhancements can be utilized to minimize the number of benefit plans that need to be configured and maintained while providing flexibility to manage all of the varying member responsibilities that you do have. So we're going to start kind of at the very beginning here with this. I'm going to go into the sponsors module just to kind of show you where some of these options do lie and how far back they go right from the configuration perspective. So I'm just going to use my general state Medicaid agency sponsor in my demonstration environment. And we're going to go over to org policy. Within org policy, we're going to choose the Medicaid fee for service. Choose my policy plans. Choose Medicaid fee for service. And then we have our copay groups. where we can apply cost share variations. Again, the description is what you want it to be. These are completely configurable descriptions that we'll look at also in just a moment. So here's your, we'd have available copay groups that can be applied. If we want to apply copay maximums, different groups that are configured within the system, we can allow for cost share variation. We have the different descriptions for copay groups, the rate codes that are applied, coverage codes that are applied, if they're copay exempt or not, and the amounts of those copays. So those are created here in org policy. We also have the policy limit groups, or we can vary by cost share tiers or copay tiers, again, configurable in your terminology. Again, rate code, coverage code, and the tier that gets applied. This is where we can see individual benefit deductibles, max out of pocket, an annual benefit max, co-insured charge max, individual lifetime limits, and individual max out of pocket percentages. Family, and then we go into the family. Same type of deal here, but at the family level for benefit deductible, max out of pocket, annual, co-insurance charge max, family lifetime, and family max out of pocket percent. Keeping that all in mind, we're going to go over to policy administrator, which is where the actual configuration of the nomenclature and stuff happens. So we have our copay groups over here on the left-hand side. You're able to see some of the copay maximum, again, configurable naming descriptions here. But if we wanted to choose any of the items for available copays and select the groups below, we'd be able to see if it's copay exempt, family planning copay, and a basic office copay tier level 3. We have copay types. Again, this is where the configuration is done, so we can name these anything that pertains to Maine, so it could be state-specific copay types. And then we have our limit types below. Regarding any of the descriptions, again, this is where the naming convention comes in only. And then we have our limit groups. Here's our copay tiers that we saw at the org policy level and the configuration that gets done here. You have the ability to add and then see the information listed below. Again, we saw this on the other screen. Okay. We have our cost share tiers, where we can establish the nomenclature here for your cost shares, whether it's copay exempt or not. And then our share of cost types. And this is what you saw in the drop-down list on the benefit as well. So this is, again, is where the configuration starts out, so to speak. But then once it's done, the major part is to actually attach it and be able to view it at the member level, right? So I'm going to show you here in administrator because we're here, and we did show this also from the member's perspective in View 360. Okay, so we're in the member's record again. Much better viewing and visibility in View 360. However, you're wanting to look at some of the information of the member record regarding the questions that we've received. So I'm going to first go to the eligibility screen in the member's record, where I can see below the rate code information that's applied. Here's the primary segment for this particular member. I can see their coverage details listed below, whether there's one or multiple. Under enroll coverage history, If I select this option, I'm going to see the complete history of this member's coverage with any effective and term dates. This is the complete compiled list. If I wanted to add enroll coverage, I can add enroll coverage from here, applying the information at this level, make this bigger, information at this level, or I can do an edit, changing the effective and term dates, or I can do an add and add in a new coverage and rate code information. So that's at the particular member level for this. Moving down to our attributes and share of cost. This is where we would assign the member their current share of cost information. By selecting on the share of cost, I also would have the availability and ability here to see anything that's been used by a claim. So if I knew the month and year that it was, it would list out the total claims here that we're utilizing share of cost.
Hey, Cindy, before you move off this screen,
Mhm.
I just wanted to point out to the state folks, we've had a lot of discussion about non-binary and gender identity, and I think we've given you the answer that 5.0 would have an attribute on the member that gives you gender identity in this case. So I think
That's correct.
I think you're seeing that right here.
Yeah, this is what I displayed in the member session. Yes.
Okay.
Yeah, it doesn't have any editing functionality, right? It's just an attribute that allows for reporting and recognition. Mhm. Okay,
Thanks.
you're welcome. You're welcome. Okay, so moving on, let me find my notes here. Okay, next we're going to move on down to cost share information. From here, we can see that. Okay.
For the share of cost on the historical search, does this reflect the retroactive costs that were assigned and the date it was updated?
No, this would have all of the information from the effective and term date and when it was updated. Yes. As far as the claim list goes, it would be whatever is utilizing in that span by the selection, by the month. So whatever it's going to actively do the search at the time you do the search.
Okay, so just to clarify, this this module that you're in right now, you can filter by your month and it would give you the claims used. So if you would close that down, the one down on the left-hand side, would that list out the multiple share of costs that were assigned and
Yes.
termination dates and updates? Okay, perfect.
Yes. Yes. And
Yeah,
I could.
the only thing I want to add to that, Melissa, is that today all of Maine's stuff is in a custom gap table.
Yeah, that's what I mean.
Unless we move to the QNext or the CEF base, you still won't see it there, right? So one of the things that we're going to have to do is figure out if we can house our current data, regardless of whether we use some level of custom code or no custom code, moving our data from the custom gap table to the table inside of CEF starts to give us some of the visibility that helps you out right here, right?
Right.
Perfect.
Yes,
Hopefully
that's
that
exactly what I was looking for.
Yeah.
Thanks.
Yeah, but it will take a step to do that, and we're going to want to do things like that.
Yeah. Thank you.
Sure.
You're welcome. Thanks for asking. All right. And then cost share on the last screen, income level. For users with appropriate permissions, I can select and show the actual income information as well.
Again, custom table in Maine, right? So to use this, we'd have to move it in.
Yep. Both of these too. So here's your copay tiers. Again, down below, I can select the information regarding the copay, effective and term date listing here. whether or not they were exempt or not. So this can be added, these are added to the member's record in these locations. Okay, are we all set with this? Any questions before I move on to some of our other tables? All right, we're going to go into some of our new tables regarding NDCJ code. So we're going to go into our claim finance codes. Make this bigger. We have a new table for drug rebate. Put in there. So the drug rebate selection allows you to do a search for a specific code and then see the NDC information that is related. So I'm just going to scroll here, find one of our J codes here. So I'd be able to see all of the relatable NDC codes for a particular code set, whether there's multiple, be able to select on one. When I select on it, I'm able to see the information regarding the code, if there's any modifier, and the NDC information, if there's a description, whether or not it's a single source drug comes off the CMS list, yes or no, and then a rebate indicator. This rebate indicator would be selected for any of the drug rebate processing. So here's where you could access your list of NDCs related to a specific J code or other HIPAA code.
What about some of them that term and then go back, then are effective again on the rebate list? Would it have more than one line or?
Yes, they would have more than one line. So you'd see this indicator, and then it would have like a term date, and then you'd see it again for a new effective and term date.
Okay, great. Thank you.
Mm-hmm. Yeah, absolutely. All right. Sticking in our claim finance codes, though, we're going to now take a look at our NCCI. First stop, though, we're going to start at Global Days. We'll use our surgery. So one of the new informations that you're going to see here around Global Day templates is that with this release, let me hit the edit button. With this release, administrator uses the multiple checkbox in Global Days to identify those codes that are subject to the multiple procedure payment reduction logic. So only those that are selected will be considered during adjudication. So all services that fall into that range are not held to the multiple procedure payment reduction will now process at full payment. We can also apply NCCI at a type of bill level. So let me go ahead and get into our type of bill. Scrolling. So just as an example, we have the option here to apply NCCI editing to a specific type of bill, down to even to that level, if applicable, in your policy. So that is a new feature. Moving on, we're going to go to modifiers. At a modifier level, you'll have the option to bypass modifiers. And in this example, we're going to use, let me see if I can get down. We'll use 59. Or we can bypass MUE editing at a modifier level. Again, based on policy and your need, but the ability is here to do so. And the really exciting part, I know Diana's going to be really happy to see this, but under MUE units, we now have 3 tables for DME, outpatient, and practitioner that can be configured. The tables in my environment are currently blank, but you have the ability to load that data through the process of getting the data in the system through the backend to load the tables up per your requirements. Gonna go to CPT bundle groups. So the CPT bundle groups and other CPT bundle groups, it was enhanced to allow users with appropriate permissions to add, update, and bypass rules for each one of the items here. So we're going to go ahead and choose, let's just choose a group. Choose search procedure. And here's all the group pairings. We can see any effective and term date information as well. But by selecting on the code pair, you can see if there's any default bypass rules that have been configured.
Hey Cindy, just a question real quick on, will this also show historical MUE records?
It doesn't historical. If there are like these term pairs that have it, we'll have the effective and term dates. We generally don't delete anything. So if you're going, I'm sorry, can you go back to the question, who asked the question so I can make sure?
Yeah,
Okay.
Richard, you can expand.
Yeah, so are you looking at this table here, or you were looking at the previous with the 3 new tables?
The previous table.
Okay, yeah, then that information, like I said, I don't have it to show, but yes, all the historical data as updated is available for sure. Yeah.
Okay, thank you.
Mm-hmm. All right, so we're back here on to the bypass rules. The bypass criteria evaluated for claims and editing bypassed on the criteria that can be selected below. Otherwise, the code-to-code edits are fired on the claim. So we have information around bill type, revenue code, diagnosis code, places of service, even provider type and specialty, to the program that's affiliated, the benefit plan, the rate code, or even the coverage code. So we can see that this one is particularly has been set up with effective and term dates. So you'll be able to see all the information, whether or not prior authorization is required, etc. So it's quite a bit here to add or to edit any of the bypass rules here. And as we saw earlier, when I was showing you the new edits, we do have new edits that are corresponding to this regarding 1132, where the code to code edit is bypassed, 1133, which was there was a major code in history, and 1134 is there's a component code in history. So there's new edits that go along with this functionality here. And the last piece that I can, I'm going to show you today is around configuration. And we showed you about those new tables. So let me go ahead and show you the provider types. So from this perspective, when loading provider types in the system, whatever it may be, we have the ability to edit those provider types and add in the NCCI class of those 3 tables. So for professional claims, you can add the practitioner table if you'd like, or DME, whatever one makes sense for your policy. So any questions? I know I walked through a lot, and I'm glad that this is being recorded for you.
I
But
think
there's
Diane
quite a
still
bit.
has a question. Diane's got
Okay.
another question, it looks like.
Okay.
Yes, on the, now you list the professional and the institutional claims. But professional has both DME and professional tables for, is this a provided to private edits we're still talking about?
Yes.
So are we looking at, oh, there's a DME drop down. Okay, I just want to make sure we're looking at all 3.
Yep. Yes, ma'am.
So in order to, because I've always wondered, the way the table is set up, it's got one match and whether modifiers are allowed or not, that doesn't always, it isn't always the same between the 3 tables, correct? Might the matches be different?
I would think that they could be, yes.
Yeah.
But
So
we have to double check. on that from the testing perspective and throw some scenarios at it and see what it looks
Right,
like.
so maybe if we chose one of these here, then it would put that type of provider to the correct table, maybe, I don't know.
Correct.
Yeah.
That is correct. Yes.
Okay,
Yeah, and Diane, you kind of hit and I think to Richard's question as well. So one of the complexities, right, when we think about the custom stuff you have today, and you have custom gap tables holding information, right? We certainly want to move you to, right, the way that the system, the new system, is going to hold and display that data. So getting that mapping right. So I don't want you to think you're going to lose any of the data that you have in those custom tables, right? It's just going to be displayed potentially in a different way, right, in the screens in which the system is going to deliver it. So, you know, that is one of the complexities, right? Because it's going to be kind of like custom data migration of everything from your custom tables over into native, right, administrator tables going forward, so you can see it. So
right.
maybe that, hopefully that's going to answer some questions other people might have in their mind, like what's happening to my data that's in my custom gap tables. That's what's going to happen. We're going to move
Yeah.
it.
Yeah, actually for this, for the NCCI portion, I think this is an upgrade to what we have.
I would
Yeah,
agree
and
with you, Diana.
Yeah, we're not doing everything 100% correctly at the moment.
Yeah, and to add to your point, Diana, too, and just to let you know that we've evaluated every bit of the Medicare NCCI guidelines, and our core functionality is compliant. So
Great.
unless a state chooses to use something like Claims Extend or any of the other outside products for whatever their reasoning and purposes might be, our core product as it sits today in 5.x, meets all of that criteria. So,
Yeah.
and we have all the reporting that needs to go to CMS for it as well.
I can see the potential for this giving us the flexibility that we don't have in our current system.
Yeah, absolutely.
Yeah,
Done a lot of work on this in the years, so.
yeah, yeah.
Hey Cindy, quick question from Heather. Can codes with multiple modifiers be priced in the fee schedule for 5.x? I heard that would be an option.
Yes, so on the fee schedule, there is a differentiator for modifiers, and I believe there's 2 modifier fields right now. But I'd have to double check that, but yes, the fee schedules can be differentiated by modifier.
And I have one more question, sorry. Back to the J code NDC lookup.
Yes.
Is there, sometimes it's easier to look up the NDC rather than the J code because sometimes the J code has so many NDCs listed with it. Is that functionality still there or?
So, the functionality to do that the way that I just stated, it's not in that location. You have to choose the actual CPT first. However, there are, I think, a few reports that have the ability to pull that out in Excel and do filter sorts. So depending on what's easier for you, right? So.
Okay, thank you.
Okay, so I think from here, if everyone's okay, we can.
You got one more question. I'm sorry.
Okay.
She's got her hand up. Trisha, I believe.
Hi, I just wanted to piggyback off what Heather had asked, and sorry, it's back on the contract piece, but so currently we can price mods off a fee schedule. And maybe she did ask this, but it's more of like when there's a double or triple mod, will the functionality be there for pricing and having double and triple mods on the fee schedule?
So, let me see if I can. I believe it's 2. Of course, I've got all my windows open. Let's see if it'll open here for me. There is, oh, sorry, it's opening. Modifiers, let's go ahead and choose this one. Just looking at table structure, I have modifier 1 and 2. So with the indicator of modifier 1 and modifier 2, if this was a placeholder, we would pay this amount. I could use the same code again just kind of like we do here with this one, adding modifiers with different pricing on the line based on either a place of service, specialty, and then the 2 modifiers in combo.
So is the first mod the pricing one? Is that what the contract term? So if that code's in a contract term with no modifiers and they bill with V1, it would obviously go find that $1,500.
Correct.
If they billed without a modifier, it would fail because there's a no modifier. There's no rate for no modifier.
Correct.
And if, say, there was a second line that was like, I don't know, V1, V2, would the mods have to be different in a way like they are now for because I'm assuming it's pricing off the first mod. So we couldn't have like V1 $1,500 and then V1 with a second mod of V2 with a different rate, I'm assuming, because they would both have V1 first.
You know, that's a great question, Trisha, but I believe, and we would have to do this in testing, so don't,
Yeah.
I know this is being
Okay.
recorded, but I believe that if there's 2 here, it's gonna find and look for both. So
Okay,
if
so
you had
that
a
would
V,
be something we
Yeah,
would be
Cindy, this
highly
is Angela.
interested
You're
in.
correct. You are
yes.
correct.
So
That
if
makes
there's
the record unique, and then there could be a separate amount for 2 modifiers versus 1
Correct.
versus
So,
none.
so you could have H0011 without a modifier and a price, H0011 with a V1 modifier and a price, and H0011 V1 and V2 with a different price, and it would find it based on the modifiers that are there.
Okay, without any intervention in the contract.
Correct.
Okay. And then the other question I had was, in the contract, for services that we price in the contract, is there a place we would see that pricing? I know that you had shown that the contract, what contract term fee schedule the contract terms points to, but if
Correct.
it's priced in the contract, would we also see that by hyperlinking on that term name?
Depending, I'm going to say it depends. If it's utilizing a regular Medicaid fee schedule, usual and customary, or if it's a case rate, kinds of whatever's chosen in that list on the contract for your payment type. Some of them will link directly, and some of them won't, based on the configuration of how that works in the system, because there's not a list to point to. So you'd see it in the pricing terms in the step edits. So it's going to depend on what is selected there, Trisha.
If there's no fee schedule at all, though, is what I'm asking. Like our facilities, PNMIs and NIFs, their room and board is priced in that term in the contract. Would we be able to see that here in View 360?
I would need more detailed examples to check that out, to be honest with you at this point. But in general, yes, if it's there for the payment type, you'd be able to see what that is. That's the goal anyways, to be able to show that to you. So we'd have to look at it.
Okay, yeah, that would be important because we would need to know if we would be able to see the rates here, because that's how all the facilities are priced. They would never point to a fee schedule.
Right. And
Okay.
then the drop down when you're selecting that, if you're selecting by DRG or whatever your pricing methodology is, yes, you'd be able to at least see what it's pricing by. If it won't link over to any of the prices or any fees based on that, then that's something we'll have to look at. But you should be able to see the payment type selected.
Okay, I'm still, yeah. So for
Yeah.
us, maybe I'm not explaining it good, but for us, the payment type is fee for service. And then it's literally priced within the contract term. So there would be no place to go look other than in the contract term for the rate.
Okay. Well, you're not going to lose the ability to do that with an administrator. I'm just not 100% sure you can see it in View 360.
Okay. Yep. Okay. Thank you.
Okay. Sorry. Anything else?
I don't see anything in chat right now or hands.
Okay, so if we want to go back to the slide deck and we can recap a few slides before we close it out. Okay, so just to kind of recap the NCCI question and the new tables, we've got some new tables in claim finance codes, and then the configuration table that did the provider type configuration. And we can go to the next slide. So there was a question that Diana had asked around the troubleshooter. So troubleshooter, she recognized or noticed right off the bat that it was no longer in administrator or accessible through administrator. And that's for a reason. And many of those reasons can be seen here. So on the left-hand side are the troubleshooter queries that are accessed today by Maine. And then on the left-hand side, how they could be accessed in the future. So technically not taking away any functionality, but the option is not available through administrator in 5.x. Putting some of this information, like for the first one, the NCCI edit 524 and exclusions, couple options here depending upon your use of that information can be done in View 360 by saving it as a community search, as we showed. Or earlier this morning, I walked you through the adjustment UI and the ability to save SQL there to pulling back some of the information. So depending upon your use of that data. And then we showed you some of the DME practitioner table and outpatient table information. So we now have tables to store that data. So you'd be able to pull back the information there or see the data in the tables in administrator that have been configured. And then the claim volume by status, again, we could use that by community search, saving in View 360 if you're looking for volume for specific day or specific type of claim and the status that it's in. Again, you can run those queries right in View 360. Mass adjustment statuses, we talked about it, seeing it in the adjustment UI, as well as receiving those notifications in View 360 when your adjustments have been completed. We saw the interpreter claim for reversal, a kind of a scenario we set up in SQL in the adjustment UI this morning. The NDCJ code crosswalk, again, there are new tables that store that data in administrator. There are SSRS reports that do pull back that information as well of what's in the tables. And I believe you can search and look for the NDC and cross-reference it that way. And then claim line gap is the alternate area right now. And I believe with the new tables and administrator, along with the reporting requirements that you guys are talking through right now, it's my understanding that it might actually eliminate the need for doing that. But we'll have to talk about that in implementation to see what you're using that for and what else we could do for you. And then the last slide. The last one, we kind of talked about some of the benefit information, scoring issues, streamlining them. Here's just some best practices that Gainwell's picked up over the years here, and I'll just walk you through some of them. They're not all in totality, but the use of service groups. So we're really trying to put all of the codes built into service groups, whether that's one or many. So they'll be in different service groups for benefits, contracts, and auth. They're based on clinical groupings to associate sets of policy rules. They're attached to one or more benefits so that it helps in ease of managing the information at the service group level. We try not to configure codes directly on the benefit itself unless we absolutely need to. Doing so in creating the service groups, it really does reduce the number of benefits that have been termed due to code terminations. And getting a code now takes place in the service group and not on the benefit itself. So all codes have a home. We try to have them either in a service group associated with a benefit property or in the non-covered codes groupings, also known as excluded services. And that can be done at the benefit plan level. And this does eliminate the firing of Edit 202 drastically. That's no benefit for service, even though we do recommend that Edit 202 still should be enabled. Also, to minimize the use of restriction groups when possible, allowing for more direct denial reasons being provided when Edit 271 does fire on the claim line. It allows for more configurable elements to be evaluated in adjudication, and it promotes cleaner scoring. And then we are really going to push and try to only configure modifiers on benefits when required by policy or to enable correct benefit selection. We really are trying to eliminate pricing or informational modifiers on benefits and contracts when needed. So we're going to talk through the rules and information with you during implementation to find the best benefit reconfiguration for you.
Tricia, did you have a question? The hand might still be up.
No, it's still up.
Okay.
I don't know
all
how to take it down.
right.
Sorry.
Okay. All right, thanks.
Well, that's the truth. All right. So from here, I think we can go ahead to the wrap-up slide to wrap up the questions. So we covered benefit limits, including the fiscal year, options for configuration. We talked through some scoring issues and best practices. We looked at code searching and reference in View 360. I gave you a little tour of the new NCCI tables. We did talk about quite a bit of the changes of configuration seen in this session as well as in some of the other sessions. We talked through the orthodontia benefit creation and just an example from my high level ability, but the ability to add coverages. And then we discussed the main copay UI classification, COC, that it's not in view at this time, but it will be reviewed in GDI to see if it's still a state need. And then the last one is talking about troubleshooter, and we reviewed the available replacements for that. Any other questions at this point? Any comments? Everybody's quiet right now.
You know my opinion, Cindy. I've already given it to you,
I know.
and it's all good.
Well, I got my former peeps on the phone, so any comments from you guys from the state?
Well, it seems like this has been a really good session and very interactive. So we thank you for that. And if there are any other follow-up questions, you can, let us know. Tomorrow we go to the next session, which is financial and flexi. That's at 8:30 tomorrow to 11:30. And then also tomorrow afternoon, we have the testing and the new testing tool ALM. That's from 1 to 3. So that's sort of our next step. And then on Thursday, it looks like we're going to have a PRIMS and drug rebate session along with a follow-up prior authorization session. So really appreciate your time today. Just last chance for any questions.
Nope.
Okay,
Thank you very much for all the information.
Yeah, thank you.
Appreciate
And this will
it.
be available for reviewing again. So thank you, everybody. Have a great day.
Thank
Thank you.
you.
Thanks.
Thank
Bye.
you.